Okay, my takeaway number 2 from the SOSORT conference in Croatia last week. If you haven't seen the first video, go and check out the first video. It goes over my first takeaway from this research conference on scoliosis treatment. And in this video, we're going to go with my takeaway number 2. Okay, my takeaway number 2 from the SOSORT conference is that we should be positioning surgery as a viable option for scoliosis treatment. What I mean by that is I don't want to push people into surgery prematurely to get treatment surgically, because I do practice conservative treatment for scoliosis. But a lot of times I see that people are really hesitant and really nervous and actually scared about going to surgery, especially, well, not just especially in adolescents, but also adults. And I think we need to put it in perspective. Most surgery for scoliosis in adolescents is very successful. They have good outcomes. Kids get back to activities that they want to do. So I don't want to paint the picture that surgery is the worst thing in the world that we can do. We had a presentation by the president of the SRS, the Scoliosis Research Society, which is mostly a surgical society. And she was talking about the benefits of surgery and the outcomes and things like that. And they align with what I see in the clinic. I don't usually see a lot of issues with surgery, with those with scoliosis if they're appropriate for it. Yeah, there are the instances of infections and having to have hardware taken out, and there's the very rare risk of paralysis or nerve damage and things like that. So those risks are real, but they don't happen very often. And so sometimes, and I've heard other practitioners talk about surgery like it is the worst possible option and you should avoid it at any cost. I don't agree with that, and through the SOSORT conference we had quite a few discussions about surgery, and surgery is not a bad option if we get to that point. There's a reason that surgery is discussed at 45 to 50 degrees in adolescents. There's a reason that adults can benefit from surgery to treat their scoliosis. Sure, I want to stop the progression so that we don't get to that point, but we shouldn't be fearful if we're at that point and resist it at any cost. I don't know if that makes sense, but I have seen a lot of patients who are very resistant to the idea of surgery, even if they have like a 60-degree scoliosis curve. If we have a large curve that's progressive and we've lost control of that curve, surgery is not a bad option. Sure, definitely look into who the best surgeons are and who you should go with that to have the best result possible. But it's not avoiding surgery at all costs. Now, there are patients who can't do surgery, especially adult patients with other health issues, or maybe they're too old for surgeons to agree to do surgery. In those cases, we do as much as we can conservatively. But when it comes time to do surgery, and when I recommend surgery, it's kind of the next step. So takeaway number 2 is surgery has a place in treatment for scoliosis. It's not part of our conservative treatment, but the results and the outcomes that we see with surgery are pretty good. So if you get to that point, hopefully you have someone to talk to that's trained in scoliosis and has seen a lot of post-op and pre-op patients, and can give you a better idea on what to expect, because it is part of our plan of care if we get to that part. So hopefully this is helpful. It kept coming back to me in the conference about, surgery is part of our continuum of care if we get to that point, and we shouldn't be making our patients scared of it. So if your provider is making you scared of surgery or saying avoid it at all costs, put that in perspective, because that's not how it should be. So hopefully this is helpful as you think about surgery. If you're someone who is getting close to surgical range or you're in surgical range, I would definitely have a good conversation with a good surgeon and a PT who specializes in scoliosis, and really make sure that that aligns with your goals and that that's the next step. But I wouldn't be fearing it and avoiding it at all costs if you are appropriate for that. So thanks for watching. Don't forget to subscribe if you haven't subscribed. This is takeaway number 2 from the SOSORT conference, and if you haven't watched 1, watch that one. And if you want to watch number 3, stay tuned. Thanks.